In this tutorial, we will review the different administration options. To access administration, go to Navigate and open your administration folder. You will then see multiple navigation buttons. We will start with Address Data. This tab maintains state and zip codes. State codes are the options available in any state field throughout Perfect Care. You can add an additional code by right-clicking and selecting New, entering in the state code, the name or description, and then the country. And then clicking OK. To remove a state code, you can right-click and delete. Under zip codes is where the zip codes are maintained. Zip codes are typically added through the patient registration screen as new zip codes with states, city, and area codes change. To access the zip code, enter in the zip code and then click Search. Here you will see all city, states, and area codes that are attached to that specific zip code. To make a change, you can double-click on it. You can add new ones from this screen also, or you can delete ones that are completely incorrect. The next option is Audit System. This tab maintains audit information for information that is changed or added in the patient registration screen. This log is for NCG use only. Client administration should review this log by going to a specific patient account in the patient registration screen and accessing the log through Patient Registration menu and then Audit Report. Here you can put in specific dates and it will list any changes or deletions that have been made to this specific account. Our next navigation tool is Code Tables. Code Tables is where all field codes are maintained for different screens in Perfect Care. Here you will see your different options such as your appointment cancellation reasons, confirmation reasons. You can also add additional ethnicity, preferred language, marital status, and phone and email types that you see in the patient registration screen. Again, anything here can be added to by right-clicking and doing New and entering in the correct information. As seen here under phone type, you see a lock next to the code. That means this code cannot be deleted or changed, but you can add to, and the ones you add, you can delete by right-clicking and deleting. The next section is Electronic File Services. This is where eligibility module and insurance electronic file services or internet billing is maintained. In the eligibility section, you will see under insurance a list of all insurance websites that we have access to through Perfect Care to check eligibility. If you click on a specific insurance company, you can add insurances that are in your insurance database. To do this, you would click on the website, click Add, enter in a search criteria such as the insurance name, in-house code, or billing type, and click Find. This will list all insurance companies with that search criteria. When you find the insurance in your database that you want to connect to the specific website, you would check the box and click OK. You will then see a plus sign appear next to the insurance website. If you click it, you will see the insurances that are attached. And if they're incorrect at that time, you can check them, and in the bottom right-hand corner, remove them. The practice section is how you are set up to check eligibility. So if it's listed as practice, for that practice itself, it will pull your practice MPI. If it says provider here, then it will change it. If you click change receiver type, it will change it to provider. That way when eligibility goes out for that specific practice, it will go out with the provider MPI number. This is typically set up by NCG when the eligibility module is installed, so you do not have to worry about having to maintain this information. Insurance billing is insurance forms that are set up for you to send out electronically through the internet using Perfect Care. And electronic bill notifications is so that you can configure certain users in your system to get alerts anytime any kind of electronic notifications come in, such as your confirmation reports for insurances and also ERA files. You can configure or add users or remove users by clicking the Add button. It will open up your database with all available users that are in your database, and you can select the users that you want to get notifications. When the list is configured, you can select a user and remove it. The next option is Import Diagnosis Codes. This again is a tool that NCG uses as an administration company. Here, if you purchase a specific diagnosis code formatted disk, we can install it, uploading and correcting or making changes to any current diagnosis codes and descriptions in your system. This is typically done by NCG only at client's request. The next option is Preferences. Preferences are set up differently based on which option you have selected in the first box. If you select the first line, which is your organizational line, it will make changes to preferences for all practices within your organizations and locations within each practice. You can select a specific practice to make specific changes to that practice, and also you can make changes based on location within a practice. To make changes for your entire organization, you will click your organizational name, which I am doing here. Under Preferences, you will see different changes that you can make based on screens. Here under Balance View, you're able to change your alert color in Perfect Care anytime a patient has a balance on their account. If you want detailed information, you can switch this to yes. No will give you basic information. And start in Balance View or Responsible Party View. So a pediatric office would probably want to see this information in Responsible Party Balance View. There's also a section to alert based if there's a patient's name, how old the balance is. So if it's more than 90 days old, you only want to get an alert. And you can also set it if you only want the alert if a balance is larger than a certain amount. You also have options to turn on and off an alert for if a patient has a credit balance or if the patient is in collections. The next section is General Behavior. This is where you can set up behavior by user. So what you want your background color and text color to be, if you want pop-ups enabled or not, if you want to be able to use your Enter key as your Tab key to get through fields, standby, and so on. The patient registration, also you can enable pop-up notes. default gender. If you want the system to assign account numbers based on within the practice or for the entire organization. And then you have different insurance options, such as the insurance policy number defaulting as the patient's social security number, subscriber defaulting to patient, insurance authorizing patient payment, and signature on file. The appointment section allows you to make changes to how many columns you see when you're in the appointment module. If you want to be able to see the appointment message, what time your schedule should start and end, if you want the hash marks or the individual sections of the appointment time to show, how you want information to appear in your header, the different schedule color types, warnings that you get as you make appointments, and if you want the system to auto-set location at check-in. As you go through each of these options, you will see different details of things that you can change within screens. Patient billing control and patient statement format is covered in detail under the patient billing setup tutorial. The next section under administration folder is reference data. This is where administrators spend most of their time because this is where you set up different information within your system. This is where you would add additional collection agencies, modify, change, or delete diagnosis codes manually. If you add employers, you can make modification to employers within the system. Add, change, and delete facilities, insurance companies, change information within your practice and within providers, and your referring doctors. So this is where your biggest data is stored and changes will be made to it. I'm going to review adding a new insurance. Within the insurance option, I'm going to right-click and do New. You will assign what you want the in-house code to be, and then you will enter in the insurance company's name, address, city, state, and phone number, and click Next. This screen is the important screen because you want to make sure that you properly categorize your insurance. And here, billing type is how you're going to send claims for this insurance company. Most of the time you will be doing claims through NEIC or MD-ON Clearinghouse. You always want to make sure if you are a provider for this insurance that the box assigned is checked. And payer ID is going to be the MD-ON assigned payer ID, which is on the MDON.com payer list on their website. This is where that 5-digit code will go. You can also assign the eligibility source or website here by selecting the proper insurance website. Managed care is where you will set up if this insurance plan is a capitated plan or not. By clicking capitation, it's notifying the system this is a capitated plan, and do not bill capitated services will automatically write off all services once they are entered and billed out for the first time. You also can assign payment types and write-off codes that will automatically appear when posting that payment. If you're using the capitation module and you have certain services that are covered above your capitation, you will add those procedures here. That way, once they bill out, they do not write off and they will await payment as an open charge. Billing codes are where you can set up additional codes for this specific insurance. So if you need to add a special organizational code or PTAN number that needs to go out on the claim, you can click the star to add, pick the billing form that it should appear on, and enter in that additional information. And here you can add a pop-up note that will appear when your staff is adding this insurance to a patient account. In any of these fields, you can add new by right-clicking and clicking new, access information that has already been entered by double-clicking on the item you want to review, and then within each it has detailed information. Our next option is System Tools. In System Tools, you have two options. Your first one is User Sessions. This is where you can see which users are logged into Perfect Care in case you're getting a user maintenance alert that all of your licenses are being used. Locked Objects shows patient accounts that are locked by users. If you have an account that is locked and you're getting a warning and you need to unlock that account or kick a staff member out of account, you will see it here and you will right-click and then click Unlock Account. And our final option is Users and Permissions. This is where you will add new user roles and add new users and assign roles to users. Users and role setup is covered in another tutorial. This concludes the tutorial on administration options. If you have any questions, please forward them to questions@ncgmedical.com, or you can call our support helpline at 1-800-330-1906. Thank you for watching.